Hi everyone, welcome to our channel Canadian Nurse Expert. We are going to practice some next-generation style NCLEX questions. Let's dive into today's topic. Psychiatric emergencies require swift and effective crisis intervention. Therapeutic communication and client support are critical components in managing these situations. Let's explore how to handle such emergencies with care and professionalism. Which of the following is the most appropriate initial response during a psychiatric emergency involving a client threatening self-harm? A. Call for security assistance immediately. B. Acknowledge the client's feelings and ask them to elaborate on their distress. C. Leave the client to calm down alone. D. Administer sedatives without assessing the situation. The best choice will be B. Acknowledge the client's feelings and ask them to elaborate on their distress. Which therapeutic communication technique is most effective during a crisis? A. Offering personal opinions to redirect the client. B. Reflecting the client's feelings and summarizing their concerns. C. Avoiding discussing the issue to prevent agitation. D. Giving complex instructions for the client to follow. The correct answer is B. Reflecting the client's feelings and summarizing their concerns. Which interventions are appropriate for de-escalating a psychiatric crisis? Select all that apply. A. Speak in a calm, steady tone. B. Avoid eye contact to prevent confrontation. C. Provide clear and simple instructions. D. Maintain a safe physical distance. E. Use physical restraints immediately. The right responses are I speak in a calm, steady tone. C. Provide clear and simple instructions. And D. Maintain a safe physical distance. Which behaviors align with active listening during therapeutic communication? Select all that apply. A. Maintaining open body posture. B. Nodding appropriately during the conversation. C. Interrupting the client to clarify details. D. Reflecting on the client's words. E. Avoiding prolonged eye contact. The right responses are A. Maintaining open body posture. B. Nodding appropriately during the conversation. And D. Reflecting on the client's words. A 24-year-old client presents in the emergency department, appearing highly agitated and pacing the room. What is the first action the nurse should take? A. Approach the client quickly to establish control. B. Offer a quiet private space for the client to sit. C. Ask the client to immediately explain the reason for their behavior. D. Restrain the client to prevent harm. The best option is B. Offer a quiet private space for the client to sit. A client experiencing a panic attack reports shortness of breath and feeling like they are dying. What therapeutic communication response should the nurse prioritize? A. Let's focus on your breathing together. I will guide you. B. I'll call the doctor to evaluate your condition. You're overreacting. Try to stay calm. D. What triggered this attack today? The correct option is A. Let's focus on your breathing together. I will guide you. The primary goal of crisis intervention is to restore the client's blank while minimizing harm. The answer is psychological stability. When a client expresses feelings of hopelessness, the nurse should use the therapeutic communication technique of blank to validate their emotions. The answer is reflection. Place the steps for de-escalating an agitated client in the correct order. A. Assess for safety risks to the client and others. B. Use calming communication techniques. C. Offer a quiet, private environment. D. Identify the client's immediate needs. Let's rearrange in the right order. First, assess for safety risks to the client and others. Then offer a quiet, private environment. Next, use calming communication techniques. Finally, identify the client's immediate needs. Arrange the following therapeutic communication strategies in order of effectiveness during a crisis. A. Establish trust and rapport. B. Use active listening techniques. C. Provide reassurance and clear guidance. D. Summarize and clarify the client's concerns. First, establish trust and rapport. Next, use active listening techniques. Then, summarize and clarify the client's concerns. Finally, provide reassurance and clear guidance. True or false? During a psychiatric emergency, it is appropriate to administer restraints as the first-line intervention to ensure safety. This statement is false. True or false? Therapeutic communication involves giving advice to the client to solve their problem effectively. This statement is false. Match the therapeutic communication technique to its purpose. Let's see how we connect the definitions. Reflection encourages the client to express deeper emotions. Paraphrasing shows understanding by restating the client's message. Clarification ensures clear understanding of the client's statements. Silence allows the client time to gather their thoughts. Drag the following phrases to categorize them as therapeutic or non-therapeutic communication techniques. I understand how difficult this must be for you. Why would you do something like that? Tell me more about how you are feeling. You should stop thinking about it and move on. Let's see how we can categorize these phrases. Therapeutic. I understand how difficult this must be for you. Tell me more about how you are feeling. Non-therapeutic. Why would you do something like that? You should stop thinking about it and move on. Moving on to a short answer question. How can the nurse use therapeutic communication to support a client experiencing suicidal thoughts? Answer. The nurse can provide a non-judgmental, empathetic environment, actively listen to the client's concerns, validate their feelings, and encourage them to express their thoughts openly. The nurse should also ask directly about suicidal intent to assess risk and collaborate on creating a safety plan. Please like, share, and subscribe for more videos.